Hello and welcome to the group room where we're at the 34th annual CTRC-AACR San Antonio Breast Cancer Symposium. I'm very glad to be back with you, Professor Dr. Stefan Gluck. You are the Associate Division Chief for Clinical Affairs in the Division of Hematology Oncology at the Sylvester Comprehensive Cancer Center, the University of Miami Health Systems, where you're also the Clinical Director of the Braman Family Breast Cancer Institute and Professor of Medicine at the University of Miami. And you love your work in the area of breast cancer.
Absolutely. It's my professional life. I do everything and anything for my patients and for those who might be patients in the future.
Let's talk about the addition of Avastin to conventional therapy, improving progression-free survival in the HER2-positive breast cancer patient.
Yes. So why am I chuckling? And you know it, of course. Avastin was initially approved on a very extremely actually well-designed study, but run by ECOG, Eastern Cooperative Oncology Group, which is not pharmaceutical. And it was not meant to be a study to approve a drug. It was meant to do research, what we do best. We are not here to approve drugs. We are here to do research which leads to improvement of outcomes. Turns out the study was testing a chemotherapy versus Avastin, versus the same chemotherapy plus Avastin. And the study showed in HER2-negative, that's the difference here, in HER2-negative disease, a huge, until then unseen, progression-free survival benefit of almost half a year. Now at that time, survival was not different. There was a small blip, but it was not significant. A few patients more alive at 1 year with Avastin than without Avastin. But it was not significant, and it was not good enough for the FDA to say, let's approve the drug. So they did a very interesting trick, and rightly so. Let's do accelerated approval. And the drug was approved under the condition, show me confirming studies, confirmatory studies, 2 or 3 of them. So over the last 5 years, or 4 years after it was approved, there was a whole array of studies in HER2-negative disease that show qualitatively the same, improving progression-free survival, but not showing any improvement in overall survival. And we gathered data that it actually may have some unexpected toxicity over time, which leads to grade 5 toxicity. That's the term for death on study. And to make the long story short, even if you calculate all these studies together, the goal was the same, or the outcome was the same. Progression-free survival is better by some time, one study better than the other, but overall survival was not. So the FDA, just a month ago, or less than a month ago, revoked the approval for Avastin in breast cancer. So it's still approved for the other indications. There are 4 other indications. European agency did a different approach. They looked in each study individually and identified always the partner of Avastin, the drug, and showed that Taxol with Avastin is beneficial, and capecitabine with Avastin is also beneficial, and the risk-benefit ratio is in favor of keeping Avastin. So they approved the drug for these 2 combinations only. So you cannot combine it with any other. And it probably is correct. Anyway, now this is completely new. This is in a HER2-positive disease now. And there was some preliminary data, preclinical data that VEGF receptor and HER2 receptor crosstalk, and they influence each other in the aggressivity of cancer. So phase 1 and phase 2 studies shown it's safe and it's beneficial. So the phase 3 study now being shown in San Antonio this year shows almost, again, the same stuff. Same duration. Progression-free survival improved by what? Half a year or 5.5 months without, at the moment, survival benefit. So is it good enough for the FDA? Is it good enough for us to use it? Well, it may have been good enough 2 or 3 years ago, but now we have so many other new compounds that you discussed for HER2 targeting that it may not be necessary. I'm not saying not good, but not necessary to have such a drug adding to our HER2-positive disease.
Thank you, Dr. Gluck, Associate Division Chief for Clinical Affairs at the Sylvester Comprehensive Cancer Center, University of Miami, Professor at the University of Miami School of Medicine, and Clinical Director of the Braman Family Breast Cancer Institute. Thank you always for making time. I love your passion.
Thank you, Selma. It was a pleasure to be here.